Welcome to the CannMed Coffee Talk podcast, where we talk with the leading minds in cannabis science, medicine, cultivation, and safety testing. I am your host, Ben Amaralt. I'm the marketing manager at Medicinal Genomics and proud member of the team that puts on the CannMed conference every year. Head over to CannMedEvents.com now to learn all about our CannMed 2021 event, which will take place September 29th through October 1st at the Pasadena Convention Center in Pasadena, California. While you're at CannMedEvents.com, don't forget to purchase your CannMed 2021 ticket. Although the early bird deadline has come and gone, you can still save by purchasing your tickets in advance. Plus, you can check something off your to-do list, and that's always a good thing. And if September can't come soon enough for you, we do have a few things that can hold you over in the meantime. First is our CannMed Archive, which is a searchable video library of all the past CannMed presentations and panels. You can find the CannMed Archive on CannMedEvents.com. Just click the banner on our homepage. We also have the CannMed Community Facebook group, where you can interact with other cannabis science enthusiasts who share relevant articles, papers, videos, photos, memes, podcasts. You know, all the stuff you love about Facebook. Go to Facebook and search CannMed Community to join the group or use the link in the show description. I also want to remind everyone that the healthcare provider study we are doing with the Cannabis Center of Excellence is still ongoing. If you are a healthcare provider, please take a few minutes to complete the survey to help us better understand medical cannabis knowledge, attitudes, and practices among healthcare providers in the U.S. and Canada. As an added incentive, one lucky participant will win a CannMed 2021 practicum and full conference ticket. The link to access that survey is in the show description. Our guest this episode is John Malanca. Through a family hardship in 2011, John and his wife Corinne founded United Patients Group, a trusted resource and leader in medical cannabis information and education for patients, physicians, pharmacists, governments, and organizations, both domestically and internationally. UPG also acts as a virtual hand for patients and their loved ones struggling with chronic and terminal illnesses by helping them navigate through this ever-changing industry. At CannMed 2021, John will moderate a panel of medical cannabis experts to discuss and answer some of the reasons why cannabis is essential to wellness and not a one-size-fits-all medicine. During our conversation, you will hear the powerful story that brought medical cannabis into John's family's life as we explore the challenges patients face when beginning cannabis treatment. We also discuss how the cannabis medicine landscape has changed over the last 10 years, the fact that cannabis medicine is not a one-size-fits-all medicine and treatment needs to be personalized to each patient, the limited guidance many patients receive from medical providers when it comes to cannabis medicines, the limited education most healthcare providers have on the endocannabinoid system, how patients can navigate through the number of cannabis products, and more. Before we get to my conversation with John, I wanted to thank this episode's sponsor, The Canigma. The Canigma is a cannabis education site that's committed to making sure scientific information about cannabis is accessible to anyone who needs it, be it to relieve their own suffering or that of a loved one, to learn a bit more, or even just for fun. The site takes an evidence-based approach to every issue surrounding cannabis, from safety to cooking to medical research, and makes all of that information digestible and useful. Learn more at Canigma.com. Okay, and without any further ado, please enjoy my conversation with John Malanca. Good afternoon, John.
Thanks
for
Ben.
Joining us on the podcast. I'm doing great. And I want to thank you first for being a part of CannMed this year and moderating our medical panel. It's going to be a great talk, and a lot of it's going to be about patient education, which is a great topic because I think we at CannMed and on the podcast, we talk so much about how cannabis and cannabinoid therapies can help people and the research that's going into it. And that we sometimes forget how difficult it can be for patients to put that information into practice. With that said, I was hoping you could share your story of how you got involved with cannabis medicine because I think it's a nice place to start and it dovetails nicely into exploring the topic of patient education.
Yeah, first off, thank you for you and your team for even considering me and having me on, not only in your show here, but also um, to lead MC the panel, which I've been in this industry for quite some time, and those are colleagues that I've worked with for the past 10, 11 years, and so it was exciting when that opportunity came up. But how we came into it, cannabis. I'm 54 years old, and so, I had, cannabis was part of my life in high school and in college, and I stopped at 21. And it's funny, I run into buddies from the old days, and they're like, "Oh, nothing has changed." I'm like, "No, there was a whole gap in between there." But in 2000, my background has been in branding, marketing, advertising for years. I worked for travel websites and magazines, and I was constantly on the road. And my wife was like, "Come on, babe, we got to do something that keeps you home," because she was always on the road with me. And we were coming by this is 2008, 2009. We were driving by a conference that had medical cannabis cup, and I don't think it was the High Times; it was something else at the time. And I said, "Pull over." And I called her Mary Poppins because she didn't drink, didn't smoke, worked out. I mean, everything. And she goes, "What are we doing?" And she had just picked me up at the airport. And I said, "Pull over." And so we went in there, and everyone was setting up. It was a Friday, Saturday, Sunday, but everyone was setting up Friday night. And we walked through there, and we met some cool people just setting up. And we got back in the car, and we said, "How is this medical? How is this medical?" There wasn't anything medical in there. And so our brain started going. And we said, "Let's do something for medical." And we started just brainstorming. We met a web developer, and we started putting some things together. And then out of the blue, my father-in-law, it was Super Bowl Sunday. I was outside barbecuing, and he comes up and he says, "I have something to share with you." And I said, "What's that?" Thinking he and my mother-in-law bought a Winnebago or traveling or do something. And he said, "I have lung cancer." And it's like, "What?" And he hadn't smoked. Just show you the repercussions of that. I think he hadn't smoked in 20 or 30 years. Just show you
Wow.
the repercussions of cigarette smoke. I said, "What do you do?" "Oh, don't worry. I'm going to go in. They'll take care of it." Well, he did do a round of chemo radiation, and it knocked him on his butt. And he went from a healthy 77-year-old man to looking like a prisoner of war, 24/7 oxygen, and just wilting away, I should say. And about a year and a half prior to that, or probably about a year prior to that, my father passed away, not from cancer. And so I was just an emotional wreck. One, now they hadn't ever experienced passing in their family. My Corinne's grandparents are still alive they passed at 98, 97, and they've been together
Wow.
since age 16. So isn't that what life's supposed to be? So um, he went back in after treating his lung cancer, and it turned out it metastasized to his brain. And so he has a double whammy. And now they've given him 2 weeks to live. I said, "May I go into your next oncology appointment?" Wheeled him in with oxygen tanks. Like I said, he was just wilting away. And we asked the oncologist, "How much time do we have?" And she looked at us in shock and said, you know, "Really?" And he said, "This is my family." And she said, "Probably 2 weeks." And through tears, I said, "There has to be something." And she said, "I can give you morphine." And he said, "I'm not in any pain." And I looked at Corinne and I looked at my in-laws, and I was a stupid boyfriend then. I wasn't the husband yet. So I said, "I don't mean to offend you," because it was popping up all over California, all these dispensaries. And I just said, and Corinne and I had come across a study that showed 40% of cancer patients pass of malnutrition before cancer takes over. Same thing with AIDS patients, wasting and wasting and wasting, and then die off, so to speak. And I said, "I don't mean to offend you." I said, "What about medical cannabis? And what about cannabis?" Didn't even know medical then. And I said,
Mm.
"What about cannabis for," and I probably called it marijuana then, what about marijuana for appetite, um, uh, help with, because, munchies. And so the doctor said, "I know nothing about it. Go for it." I said, "Deem Corinne the caregiver." And we ran down to the dispensary. and she knew nothing. I mean, she had never tried cannabis. And we went down there, and back then it was night and day, 2010 to what's happening today in 2021 of what's out there, regulations, labeling, information, quality, testing. So we went in there. I'm like, he can't smoke. Let me get a let me get a chocolate bar. Okay, so we go back and get him a chocolate bar, and Bennett knocked him on his butt. I mean, I have chills right
Mm.
now telling you this. Knocked him on his butt, and I'm thinking, oh gosh, what have I done? Again, I was a stupid boyfriend, and I was more scared and embarrassed than like, hey, let's get back. And I said, please, 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 let's go back and try it again. So we ran down there again to the dispensary, and there was a dispensary in the area. And thank goodness we live in California. This is what
Mm-hmm.
happened, and I'll get into this through as the conversation goes on. And Corinne and I came across, and the only reason we went this way, we found a coconut oil capsule. It was an oil-based capsule, and the only reason we went this way, we knew we could freeze it and cut it into slivers. There was no labeling on it. It wouldn't say one dose. Back in those days, it would say, one dose, but it was enough to fill, I would say, to feed a NFL football team. And so came back. It was a 10 milligram capsule. We froze it, just cut it into slivers, just prayed and hoped that something would work. Within 24 hours, he wasn't totally uncomfortable, scary, high, but he was eating, and he hadn't eaten in a while. And I'm like, oh, wiping the sweat off my brow, like, okay, cool. He's eating. Day 2, day 3, day 5, he started eating. He's sitting up in bed. Again, he's on 24/7 oxygen, and his complexion started coming back with, blood coming back. He's feeding his body with food. And about day 5, he's up in bed and he's typing on his, iPad or computer at the time. And every day we would call, did he make it through the night? Did he wake? Every morning we'd call, did we make it through the night? And we went over there day 8, and we go over there and he's shuffling around the house. And I said, don't get too cocky. He said, well, I have energy, and that's part of what we said. Great. He'll pass peacefully. And I'll fast forward this, and still he would just take the 3 milligrams every morning, just in that capsule. And he started functioning, and he's walking. And at 6 months, hospice fires him as a patient because he's walking, he's driving, he's swinging a golf club. They were traveling. And we said, I'll be darned. And so we started doing a lot of research about this miraculous plant. And we started at that point. We had said to halt to our our web designers. Let's don't do this. Let's build a website that people can come to, get information, get guidance, see clinical trials, see the science, and not be embarrassed. Back then, the stigma back then is not how it was then.
Mm.
Today, back then it was, you had to look over your shoulder, who's watching you. God forbid you're on a train or a plane or whatever, and someone sees that you're looking at, a marijuana website, and so we wanted to build a site that doctors and patients and families and governments and pharmacists could trust the information and not feel like someone's looking over his shoulder, like, oh, I caught you, I caught you. And so by that point, we had already met a lot of people. And actually, a couple of them were on the panel. That's why I was really excited when you guys asked me if I would partake in this. And so we started incorporating fecal oil, full extract cannabis oil. And a lot of people call it Rick Simpson oil. And I don't want to take anything away from Rick Simpson oil, but Rick Simpson's protocol, Canadian, skin cancer, high THC. And it's not a one size fits all, and we'll get into this. His is take a gram, and more is better, and that's not always the case. And all cancers are treated differently, and this is again part of what this panel is about. This clinical focus, that it's not a one size fits all. Age, weight, current health condition, the sensitivities, the stage of the ailment, and God forbid it be cancer, but also drug to drug interactions. And so what works
Mm-hmm.
for me, you and I both young males. You're probably a lot younger than me, but but our formulation, our guidance, our dosing, may be different, from sensitivities and how our body's made up. And so by that point, we at the 6 month mark, we incorporated the fecal oil, still minute amount under his tongue at night before bed. It was a 4-part THC to
Mm.
1-part CBD ratio of this oil, and we would do it at night, just because he could sleep through any of the psychoactive if there was any, and a couple times there was, and so. Um, And at 9 months, I'm fast forwarding the story. And at nine
Wow.
months, the phone rang. It was 10 o'clock at night. Corinne and I are in bed watching TV, and the phone rang. And we're like, oh my gosh, here's that dreaded call. And it was my mother in law. We picked it up. I said, is everything okay? She said, check your email. Jumped out of bed, checked the email. And there's an email that they sent from their oncologist that said, no evidence of recurrent disease. And talk about the tears of joy this time. And it was like, oh my goodness. There is science behind this. It does work. And I never want to give anybody false hope because I've seen this plant work
Hmm.
and I've seen it not work. Working to me is saving a life, saving a body. Working for someone else could be I sleep better. I'm not in pain. I have a relationship with my family. I'm able to get off my opioids. I'm able to have movement. I'm able to, control my diabetes, my epilepsy, the list goes on. And so Corinne and I, not only having this success story and being able to share it to the world, you know, um, people always say, you guys are good ambassadors. Again, bringing the stigma back in 2010, 11, 12, 13 to where it is now. People automatically thought, oh, you just want to get high. You just want to get high. And so
Yeah.
we went on this journey of education and information, and not only educating the patients and families, but the most important, educating the doctors. Patients now, cannabis is not going away. Good or bad, it's not for everyone. I'm the first to say that's not for everyone. I never say cure, and I never say it's the golden Willy Wonka ticket. You take this and you're healed. There goes, and I'm a fan of a whole arsenal of getting your body back to balance. If it's exercise, if it's diet, if it's cannabis, if it's prayer, meditation, whatever. I'm a big fan of all that. Um, and I'm a fan of conventional medicine as well, and incorporating that as well as integrative, as well as functional, and then cannabis and other herbs as well. And so we started on this journey of the importance of educating doctors. And as California was leading the way back then, it's been legal since 1996 at the medical level. Other states started to follow, but the one thing that was lacking was no one knew what to do.
Yeah.
And so it would say, oh, great, Ben. I'm a cannabis doctor, and here's your recommendation. And call me in a year if you have any questions. Well, what do I do now? I'll just go down to the dispensary. That's great when you and I are 20. We've probably, had those type of days. You're like, ooh, won't be doing that one again. Like,
Yeah.
whew,
Right.
but when you're sick or you're a scared parent with a pediatric child, or you're a scared child with a geriatric mom and dad, or even yourself, you want to make sure that, they're getting the right guidance. And so it's frustrating. And I've seen a lot in this industry over the past 11, 12 years of what patients think more is better. Oh, I have sleep issues. Let me take that. And I'll go into the dispensary. And I have anxiety. Yes, I'll take that. And I have an eating issue. Suddenly I'll take that. And they walk out with 16, 17 products. No exaggeration. I've worked with so many seniors at retirement communities, and they show me their bag of goodies that they grabbed.
Hmm.
And it's like, oh, and so that's the part, as cannabis is becoming more of an approved, and I will say medicine. A lot of people don't want to say medicine, but an approved option, medicine. I think it also, as it's growing in the majority of states now, not only here in the U.S. but globally, doctors need to be educated because it's not a one size fits all. And I share this with patients and doctors alike, that it's not illegal to ask the question, even if you're in an illegal state. Some doctors are like, I don't want to touch it. And same thing with patients. And patients, I've had them say, Ben, I'm going to act like you didn't ask me that question. And if
Hmm.
I find out, Ben, that you use cannabis, I'm going to ask you to get another doctor. And this is generally, this happens more so in the senior world, the geriatric world. Happened to my
Right.
aunt. I've like, as I mentioned, I've spoken at retirement communities, and I always ask the question, how many people have tried cannabis, and have this discussion with their doctor. And you would see the hands go up, and one one lady, she was in the mid 80s, and she said, my doctor shared, if I did use it, that he would ask me to find another doctor. And we sat there. What'd you do? She goes, I fired him. And boy, the laughter and the round of applause. I said, but I applaud her for doing that. This is her body. This is your body. and you should have options. And that's the unfortunate thing about cannabis being legal in some states and not others. God forbid something happens to you and you live in an illegal state. One, you're getting the black market, not safe and tested and regulated. Or two, you're forced to now be a cannabis refugee, which a lot of families did a few years ago. Now, they're able to stay put. But when you are a cannabis refugee, not only are you leaving your support group, your family, your doctors, your schooling, your church, your friends, everything, and going here and having to start again. But a lot of parents do that would do that for their loved one, their
Sure.
child or their loved one. And so, so that's the thing we pride ourselves on is, um, someone coined the term. We were at a conference, I think, in 2011 in San Jose, California, and there we had our booth there, and someone said, "You guys are like, well, WebMD, huh?" And I said, "That's a great way to put it in a elevator, 2-second pitch. What do you do?" WebMD of the cannabis industry, and you know, um, not trying to say compare us, but it's a site that people can come to, get information, meet with a doctor. We have doctors and nurses that consult with patients and their families and their doctors on there via phone and video. We don't write recommendations, and so a lot of patients will go to a doctor, as I mentioned earlier in our talk, like, okay, Ben, here's your recommendation. Call me in a year if you want a renewal. Okay, now what do I do? And so a lot of
Hmm.
because the doctors don't know, they're able to do a consult with our staff, and I am always invite the doctors in so everyone's on the same page as well. And so, so that's why education and information is so important. And again, as this is growing and all these products are coming out, it's confusing to me sometimes when I see all
Yeah.
these products and all these claims, and that's the thing that's frustrating is that, I think until, I don't want to say getting the government involved, but until, people really look at this as an option, it's sad because I just lost a dear friend. She was in her mid to late 60s to breast cancer, but she successfully fought breast cancer for 19 years on non FDA approved modalities. From ozone to vitamin B17, salicinium. I mean, the list goes on. But it saved her life for 19 years. She's battled this, and it's frustrating that you know Americans, we don't have access to that. And a lot of patients will go overseas where they have access, go down to Mexico where they have access. And there's some great doctors, and I think it's wonderful that these doctors actually take a stand. And I feel the same thing with cannabis. At least have an option. Doesn't work for everybody. It doesn't, chemo and radiation doesn't always work for everybody,
Right.
but at least it's an option. And so, and again, you can incorporate those with conventional medicine. If you want to go that route, please do so. You can use cannabis. It's not going to zero each other out. You can use cannabis with chemo radiation. We work with a lot of cancer patients. That's why I was saying that. And cancer has affected me, and I'll go into that in a second. Um, but if you are going to do chemo radiation, cannabis helps with nausea, appetite, sleep, mood, as well as healing. And so, I would never tell anybody not to do this and do this. And I say that how it's affected me in 2017. My wife, Corinne, was diagnosed with pancreatic cancer. And she was somebody, I mean, that's the part of life I don't understand is, you do good. You do everything you're supposed to, from treating others with respect, helping others, which we have done for, 10, 12 years here with United Patients Group, but also she ate well, didn't drink, worked out, stayed healthy. And cancer and ailment does not discriminate. And that's the thing
Mhm.
that's the part of life that I don't understand. And, why not offer cannabis as an option? As we've seen it, we've seen all the studies, we've seen it work with my father-in-law. My father-in-law actually just passed away this May 2021, but not from cancer, not from cancer, And so I'm glad that he got an extra 10, 11 years of a great life. He got to experience our wedding, and as sad as it is, he got to experience my wife's passing.
Right.
And so, but, he's able to be on this earth for another 10, 11 years. And I know, Ben, 100% cannabis had a major effect on that, and and that's why I continue the work that Corinne and I started, and the outpouring of love and support that we had not only from our community but here in the U.S. but globally when they found out that Corinne passed, and so I keep her spirit alive, and I still get calls from people on a regular basis saying, I met your wife at a conference, or I spoke to your wife on the phone when I was going through this, and she calmed me down and she directed me. And so that's what we do here at United Patient Group is direct, help people avoid the tangled web in this industry, what to ask, what
Sure.
to avoid, what to look out for. Here are some top doctors. Here are some top nurses. Here's some top products, and and that's the part that where I think this industry is going. Thank goodness, but also where it still has a long way to go. And that's the part where the government's getting involved, where they're adding regulations, and so nowadays, you know, the majority, I should say, I'm looking around to see if I had a product here, but the majority of products nowadays have a QR code that show a test result.
Sure.
Test results not only just say, oh yeah, it has THC or CBD or the cannabinoid profiles, but has it been tested for mold, pesticides, metals? Is it safe? Is it organic? Is it USDA certified? Is it grown here in the United States? Where was it grown? And so these are all things that I always share with patients as a patient advocate and a health advocate to what to look out for. Patients come to us, and what if they have 2 weeks like we had? And they
Mhm.
go down the wrong way, for 10 days and realize, oh my goodness, I've gone the wrong way. And I only have four
Sure.
more days, and they're running back. It's to have that diagnosis, whatever it is, but having the diagnosis that your loved one has is you have cancer. I'm telling you, your world comes to a halt and you're thinking, what can I do? And everyone comes at you. There's so much information, and you're like,
Right.
on this time clock that's going the other way around. So anyway, I've done all the talking. Sorry.
Yeah. No, so no, and it's a great story, and thank you so much for sharing it. It really does, like I said, set the stage for all the work that you've done since it started. Your experience started back in 2010 up until now. And I wanted to ask you about that because you had
Yeah.
mentioned that back in 2010, you went down to the dispensary and there wasn't nearly the amount of products and the amount of information that there is now. And so I have to imagine that there was some level of luck involved with that the product that you got actually worked. And I wonder if in some ways patients today almost have a more difficult time because there are so many more choices and there is so much more information. It's almost like analysis paralysis.
I know this is not video, but I'm smiling as you're sharing that because I still remember walking into that dispensary and it would just label cannabis, 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 and I remember after 6 months, 7 months, and then after getting, having my father-in-law's hospice team fire him because now he's walking and driving and do everything, and we got involved with this industry and met some scientists and doctors and labs. There's some, I won't mention names, but there's a lab here in California. And I went to them and I said, oh, can you test this? And I kid you not, Ben, it was exactly the 100% opposite of what they had it labeled in the dispensary.
Oh, wow.
And that's really put me up going, okay, now we have an issue here. But thank goodness, I don't know if we had some higher power that was, I that's the one thing that how we've always lived our life is everything happens for a reason, and everything happens for a reason. I guess good and bad because I'm still trying to figure out this thing with Corinne and even setting up for this call. I was just, I have pictures of her around here, but I just thought, how is this even possible? But seeing the different, with labeling and regulations, and I kid you not, it was the blind leading the blind then, and it was trial and error. And I kid you not, Ben, knock on wood, we had no error. And that's why coming out of the gate and hitting a grand slam
Right.
right off first pitch, going, oh, we got this. And you know what? We're going to share all this with everybody because we're on a mission now to share the benefits of this plant, and we're going to help others heal their loved ones for this. And so, again, I'm not a doctor, and all we would do would we would share studies. We would just share what we did, and as we grew, we brought on medical teams to do the science, the medical side of this, of guidance and dosing and formulation. But I kid you not, before everyone, there's about 100. People say there's 113 up to 160 different cannabinoids. I'll meet you in the middle there at 140. All cannabinoids play a role. THC is what everyone has known for years, but also has a stigma from the reefer madness years of just it's
Hmm.
high, gets everyone stoned, stupid, etc. You get nothing done. Now, there are so many benefits to THC. Without THC, I know my father-in-law would not be here. The studies show that THC, yes, it gives you, a euphoric. What's wrong with being euphoric? But it gives you the high. But it helps with mood, helps with appetite, helps with pain, but it also helps with cancer. Then you have CBD, with all its other benefits from pain and sleep, inflammation, a cancer fighter. You know, so every time I present, I always put this roll of duct tape up on my screen, and people look at me like, "Hey, man, you got the wrong screen." But I said I don't want to say cannabis is like duct tape with a million and one uses, but when you really get down to it, all the cannabinoids play a part.
Hmm.
And if you're able to intertwine these, it's called the entourage effect, they
Sure.
really work well. And Corinne would always describe it as like baking a cake and leaving the eggs or flour out. You know, that's why they go together. And you asked me one other question, and I was going to go down that road. I'm sorry. Do you remember?
Well, we were just talking about how there being so many choices and so many different
So,
products out there now, is
I,
it almost
I,
harder to
well,
find the right
yes.
the right solution for you than it was back then?
It's fun. That's what I was going to get on. So when we did this with Corinne's father, we used a four parts THC, one part CBD, and people were like, "It's impossible. You have to." And that's was and everyone was came on. CBD started hitting the road, and
Mm,
everyone talked about it. And so uh, people are like, "THC, it's supposed to be CBD." I said, "This is where the media has confused a lot of people. This wonder
sure.
drug CBD that just appeared." Not the case. Cannabis in this plant has been around for thousands of years. But the one thing that we used to go before all these other cannabinoids were introduced, and 0.05 this and take 5 milligrams of that and 1 milligram of this, we saw more success with patients just doing a regular 4-to-1 ratio. That was us. 4 parts THC, 1 part CBD. And it was amazing what we saw. And then when other things were incorporated of the different, cannabinoids and terpenes, and you saw this graph, and no disrespect to any doctors out there, but we would see this graph of higher success really with, I guess, from certain ailments. Everyone's different. We used
Yeah.
everything on my wife with pancreatic, and pancreatic's
Mm,
a different breed. And so, but I reached out to Bonnie, I reached out to Eloise, who's on the panel, I reached out to Dustin, who's on the panel. Help. They love Corinne, and they were like just going through their thing, like, what can we do? And so she made a major impact in this industry, but you know, um, it's sad when you not only lose my wife and my best friend, but when others um, that that loved her, um, just to see one of us who help
mm.
people, fall to this thing called cancer. Cancer does not discriminate. Ailments do not discriminate. Pain does not discriminate. And so there's a lot more work that needs to be done for different ailments. THCA is wonderful, CBDA is wonderful, CBN is wonderful, CBG, and the list goes on. THC, CBD. I mean, this is the thing that doctors are afraid of. I don't want my patient to get high. Or you
Mhm.
get the patient say, I want the medical portion of the cannabis plant, not the recreational portion. And this is where the media has really confused people because they think THC is bad, CBD is good, and all the other cannabinoids. And it's like, and I share this. We're in California. My brother's been in the wine business for 30 years, so I say, you and I, Ben, can go out and go wine tasting, take a sip of wine. We're perfectly fine. If we drank 3 bottles of wine, we're going to be intoxicated, probably throwing up. Same thing with cannabis in any level. They always hear them say, go low, go slow. But same thing with THC. You can have success with 1, 2, 3 milligrams. You don't need
Hmm.
100 milligrams. And so why not go with this? It's funny. We started with Corinne's father, just low amounts, and people would say, "You need the high amounts. You need to get up to a gram a day."
Yeah.
And we saw success, and we were at a conference up in Portland, Oregon, and we sat down in the lounge just to get it because we were exhibiting as well, and we just sat there taking a little break, and we could hear a doctor speaking on the loudspeaker about cannabis and the benefits of low and slow as well as microdosing. And we went, I'll be darned, this is what we've been doing for a year. And everyone's been saying, no, you got to take gram a day.
Mm.
So we ran upstairs to see who it was. And we opened the door. It was a packed room, standing room only. And you know who's on stage? Dustin
Dustin Sulak.
Sulak. And
Yep.
I said, I'll be darned.
I
So
knew.
everyone surrounded him afterwards. And so, a few days later, Corinne and I called him and we had a Skype call, and he was back in Portland, not Portland, Oregon, but in Maine. And we shared our story with him, and he says, yes, these are the things. And it's like, finally, someone, because people used to say, impossible, you guys are just telling us. I was like, we're not even selling a product,
Yeah.
And then when Dustin came out and other doctors started speaking about the microdosing, people said, I'll be darned. How'd you guys know that? And I said, it was just common sense to me. He was totally out and weak and shriveling up, and why blast him? It'd be like you and I going out for, I run and ride every day. I'm not a marathon runner, but
Mhm.
if I went and ran a marathon today, boy, my hips and my knees would be hurting. I can get up to that, but slowly build up. Let's do
Sure.
a block. Let's do, 5 kilometers, 5K, and so the same thing I think with cannabis. Our bodies are a fine-tuned machine. And this is the part that why education and information is so important, and why, as the laws are starting to expand to pretty much all the states here in the U.S., there's still a lack of doctors knowing that knowledge.
Yes.
There's still a lack of knowledge, and so we have legal access to all these Americans, but the doctors still don't know. And I still say there's about, I'm going to say, I used to say 8 to 10, maybe there's 12 to 15% of doctors that truly know about dosing nowadays. And that is part of my excitement when you guys asked me to, hey, would you like to MC this panel? And I say I would love to, and especially seeing who's on there. I'm like, oh, you're getting really the best of the best in this industry who have been around. They didn't just pop up, because they said, "Oh, I'm going to be in the cannabis industry." No, they've
Yeah.
they've been the pioneers in this industry for 8, 10, 12 years as well. And so it's good. It's good to see that, and that you. Congrats for coming out here to the West Coast this
Absolutely.
year. But to have some great speakers in any conference is important, and to be part of this panel with those medical professionals is pretty exciting.
Yeah, I knew you were going to say the name Dustin
Yeah,
Sulak when you were describing
yeah.
that, because he actually has been on the podcast
Oh,
before and we
cool.
talked about
Yeah,
dosing,
yeah.
and he, shared the information that he's gathered over the years about how he calls it a biphasic effect with
Totally.
cannabis, that low dose can sometimes be even more effective than the higher doses, and how it kind of follows this wave
Yep.
pattern, which was really fascinating. And you make a great point about how there's not enough medical professionals who are knowledgeable about the endocannabinoid system or cannabinoid therapies, and that's one of the main reasons that we've added to CannMed the full day medical practicum,
Good.
which is a pre-conference event that's led by Bonnie Goldstein, Dustin
On.
Sulak,
Yep.
Eloise Thiessen, and Kevin Spellman.
Great.
So the healthcare professionals can come and get the latest information and all that clinical experience that those medical professionals have amassed over the years, so that we can kind of help to at least increase that percentage, so there's more medical professionals out there who can give great advice.
Well, you nailed them on who you have leading that. And I've known uh, Dustin, Eloise, and Bonnie for years. They've not taking anything. We don't do conferences anymore since Corinne passed, but we used to do conferences and offered CME accreditation, and we'd have about 85-90% of our attendees were actually medical professionals, not in the cannabis industry. And
Hmm.
Dustin and Eloise and Bonnie were always regulars. Dustin and Bonnie sit on our advisory board as well, and so um, like I said, they're part of our family. Been to our home. Eloise and Bonnie both spoke at Corinne's funeral. Um,
Wow.
so it's going to be good seeing them, and it's going to be really good seeing them because this is how I've been seeing everybody,
I know.
via video. It's going to be kind of weird standing up there on stage and just going, wow, human beings, really? Is this? But excited. Hopefully, we won't have to be wearing masks while we're up there speaking. But
I know. It remains to
yeah,
be seen. We're so
yeah.
close, though.
I
So,
know, I know. I look at the news. I don't watch the news, but I do see what the COVID things are. It's like, okay, what are they going to do today? And so, but anyway,
yeah. So anyway, winding down here.
yeah.
I know I wanted to keep you. I didn't want to keep you much past a half hour, but we've been going hard here. Just wanted to leave it open to you to maybe talk about some of the overall roadblocks or pitfalls that new cannabis users can run into, maybe in terms of different product types, formulations, all the sorts of things that you're trying to address with the United Patients Group, and maybe just some good practical advice for some folks who are thinking about getting into it.
So two things: getting into it, meaning into this industry, or are you talking patients looking to cannabis as an option?
More on the patient side.
Patient side, excuse me. So one, ask questions. Do your research to see if this is for you. It's not for everyone. I'm the first to say this is not for everyone, and I do not want anyone to think this is a cure all. As I mentioned, I never used the word cure, but there are a lot of different choices out there. And just because you say, "Oh, a friend of mine is a friend of a friend of a friend knows this, and it's good stuff," he grew it or she grew it. I mean, I've known growers that have been doing this, probably longer than you and I have been alive. And
Mm.
every once in a while, they have to cut down their whole crop because mold or bugs or something was in there. So, you know, I'm a fan of a friend of a friend type of stuff, but especially when you're immune compromised, and if God forbid you're battling something as severe as cancer, make sure all your products are tested. And nowadays, in all the states that are legal, they do have testing labs, and all the products should have the not only website on there, contact information, but also QR code. And if they don't have it, this is what I share with patients all the time: go to another company. Either call the company. It's not up to you to make sure that has testing result, or it's not up to you, the patient or the consumer, to go out and test a product. You can. Do know some patients that want to double check, but make sure you find a product company that has all that information. I'm a big fan of testing the soil first, because what's in that
Mm.
soil is very important. So make sure there's no, they go from, I always say, from soil seed to sale. And check the soil. Make sure it's not toxic, doesn't have any, overflow, stuff like that. Nowadays with hemp, hemp is known as mop weed, like mopping up a spill. And so a
Right.
lot of times they would, in certain areas where they'd have a toxic spill, they'd grow hemp and it would suck up the toxins, and then they would test the soil again and go, oh, cool. We'll build a community here. We'll build church, homes, schools, etc. And so make sure if you live in a state that doesn't give you the option for THC products and CBD is your only option, I think wonderful. Go for that. But getting it at a grocery store, I'm not a big fan of.
Mm.
Getting it at your gas station, I'm not a big fan of. There's a lot of companies that are online. Look for USDA certified. Look for grown in America, and make sure it's tested. Make sure it's tested, and they test again to make sure it doesn't have any mold, pesticides, toxins, and make sure the cannabinoid profile is in there. For patients that um, work for jobs where there's zero tolerance, meaning no THC. They do have broad spectrum, which is pure straight CBD, which is also beneficial. And so you can make sure that you ask that company before you take that chance on your job, just confirming another 100% of the time that it is THC free. And so ask questions. Do not be afraid to ask questions. When you're in your doctor's office and you ask your doctor about cannabis and he or she does not know about that, or says, I prefer not to discuss it, say, no problem. I said, can you recommend me to someone who would know about cannabis? And nowadays, believe me, there's someone in every single state, that a doctor that can refer to another doctor that has that. Bonnie, Bonnie Goldstein, Dr. Sulak, Eloise. I've never met Kevin, so I'm excited to meet Kevin. Read his bio the other day. Boy, what an impressive bio on what he's done and where he has been as well, not only here in the U.S. but overseas, and who he has worked with, not only with military but sports, major league sporting organizations as well. And so, or even come to United Patients Group. I'll give us a plug. You can come to our site, get information. I'm always reachable. You can contact me, or you can set up a consultation on our website that allows you to have this discussion. And if your doctor does not know, invite them in on the call. I truly believe and feel more having a team behind you, but not only having your personal physician on there to talk, and he or she can also learn. And that's a part that really we stand by, is education as well as information. Education is huge. And I always use this analogy of throwing a pebble in the pond with the ripple effects. What someone may hear our conversation here and go, God, I never thought about cannabis, but now I am. And so, to anybody that's out there, going through something as severe as cancer, I send you love, prayers, and blessings as well. And you're not alone. And ask questions, because there are some great offerings out there, not only in our industry but beyond.
That's some great advice.
Thanks.
For sure. So John, I want to thank you again for coming on and sharing your story and telling us about the work that you're doing. And again, thank you so much for joining us at CannMed. In advance, I guess I should thank you, and really looking forward to meeting you in person out in Pasadena.
Me too. And that is going to be in the blink of an eye. It's what, 6 weeks or something like that. So, but thank you, Ben, and thank you for your whole team over there. You guys have been utmost professionals with everything you've done and the emails back and forth. And so thanks for including me as well.
All right. We'll see you soon.
See you soon. Bye-bye.
I hope you enjoyed my conversation with John Malanca. Check out the links in the show description to learn more about the topics we discussed. And thanks again to our sponsor, the Canigma. Our next episode will drop August 31st. That's 2 weeks from today. In the meantime, head over to CannMedEvents.com for the latest on the CannMed 2021 event. While you're there, be sure to check out the CannMed archive and purchase tickets to the event. You can also follow us on Instagram, Facebook, Twitter, and LinkedIn. Just search for CannMed Events. And also be sure to join our CannMed community Facebook group as well. And lastly, be sure to rate, subscribe, and follow our podcast feed on whichever podcast app you are using. All right, that's it from us. Until next time, stay safe, stay healthy, and be sure to join us on the next CannMed Coffee Talk.